So nasal polyps have a variety of causes. This is what makes polyps so fascinating, which is they're caused by inflammation and they produce a huge amount of inflammation. And for years, we thought they were only caused by this inflammation or infection, to find out that when we studied the mucus in the nose and we studied the lining of the polyps, that they were producing some of the inflammation. They were like perpetual motion machines. And this is why it's very important that the patients and the doctor understand the cause and the source and follow it, because if you allow that inflammation to reoccur, the polyps will come back. There are lots of reasons why nasal polyps developed. One of them may be allergies or atopy, and this is if you're allergic to cat dander or dog dander, your nose starts to run, it causes inflammation in the nose, and this may cause certain types of polyps to develop. There are polyps that develop from infection, which you'd like to obviously treat, because sometimes infections will stay lingering in the nose or the sinuses for long periods of time. There are polyps that develop from fungus. There's allergic fungal and other non-allergic fungal diseases that can promote all kinds of respiratory tract diseases. They produce their own set of inflammatory problems, both in the lungs that give asthma and the nose that can promote chronic sinusitis and nasal polyps. Genetic forms of polyps, they can run in families, 5 or 10%. You can find another family member, and you need to take a good family history. And there are mucus disorders, or people with cystic fibrosis that will also form certain forms of polyps. But the most common is usually related to allergy, fungus, aspirin sensitivity, or infection. Some people, believe it or not, take aspirin and they get a cough. Some of them will get asthma. So chronic rhinosinusitis is anybody with a chronic sinus infection running more than 12 weeks, or anybody with recurrent sinusitis more than 4 times a year, usually needing antibiotics, and has similar symptoms, which can be facial pain, runny nose, usually with a discolored discharge. Nasal polyps can be clear discharge or discolored. And there's chronic sinusitis with nasal polyps, and there's chronic sinusitis without nasal polyps, and they're slightly different. Getting the right treatment and following up on your nasal polyps can dramatically improve the quality of your life and your family's life, since they're living with you.